Well, President Obama's planned overhaul of America's healthcare system is getting second opinions from political doctors on both sides of the aisle. But as the politicos look for the right diagnosis to offer healthy insurance to nearly 50 million uninsured Americans, some are waiting for a shakeout in the system. Concierge doctors. They're becoming popular with doctors and patients alike. Some say it is a return to the old-fashioned house calls. Others say it's only for the rich. It's a hot-button issue, the latest in America's national healthcare debate. So what's the future for healthcare and the government? Is it the answer? Here is my take. Number one, I don't believe the government is the option, but I do think we need to drive down costs, which may mean more competition. Number two, the issue is how we create competition to drive the costs down. We need to ultimately be willing to explore multiple options, including perhaps even cooperatives. And number three, healthcare reform is needed. It's almost 18% of GDP. The rising costs are ultimately a killer for small businesses. I'm still not sure how we will pay for it. And that, at the end of the day, will be a major source of confrontation among members of Congress and the American people. All right, joining me now from Chicago, the former Health and Human Services Deputy Secretary Eric Hargan. In Phoenix, Dr. Stephen Knopes, a concierge primary care physician and author of Concierge Medicine, a new system to get the best health care. And in our studio in New York is Paul Diaz, the president and CEO of Kindred Healthcare. Good morning to the three of you. Thank you so much for being here with me this morning. Contentious issue, a lot to talk about. Let's first, if we don't mind, get to Dr. Knopes, because I'm not sure that many people in this country understand what a concierge doctor is. Let's explain that to people first off.
Sure, Alexis. Concierge medicine is really nothing more than returning to the days of Marcus Welby, where people have a personal physician who they have access to. So my patients, as we speak, have 24/7 access to me for any medical emergencies. They can see me on a same-day basis. They'll get house calls if they need it, executive physicals, and even true health and wellness care, meaning I've got a gym, a registered dietitian in my office. So everything from health, wellness care to the ICU is taken care of by your personal physician, as opposed to a big corporation or a government bureaucracy.
Mr. Secretary, should that be one of the options, or are we walking down a slippery slope? Because one would suspect that things like the concierge option are the types of options for only people who can afford those types of options, but the people we're talking about who are uninsured wouldn't necessarily fall under that type of program.
Exactly. I think that it's a symptom of the problem that we have in the system. It's an escape hatch for people who need to get out from a system that is making people wait longer than they need to. And I think the more we shift to a government system, the more there's going to be a need for concierge doctors. But it simply can't be the new model. It can't be the system that we have for 300 million Americans. We can't have taxes, and on top of that, retainer fees for concierge doctors, and then the cost of medical care on top of that.
Paul, you know, Kindred Health is in so many different areas of the healthcare industry. I know you're watching this healthcare overhaul discussion very closely. What concerns you the most about what you've heard thus far?
Well, I think you had it mainly right on your quick takes. I mean, we have clearly a challenge. We need to deal with the uninsured. We need to deal with the cost challenges. It's a structural problem for us. And we clearly need to get more people engaged in their own health and wellness and personal responsibility. I think the concern many providers have is not that we don't have a shared sense of goals, is what is the path? Will we take an incremental approach to testing things, as you mentioned, to getting there? And will everyone take responsibility?
Yeah, everybody taking responsibility. Look, I'm glad you brought that up, Paul. I have talked to Michael McAllister from Humana. I've talked to Ron Williams from Aetna. I mean, Mr. Williams has been pushing for technology and transparency for years. But they're, healthcare benefits companies which face the possibility that they could be taxed in order to pay for programs like a government-sponsored option. but something's wrong with the system. They don't necessarily love the ideas of some of the changes, but we've got to fix something, and something's broken.
No, I think that's right. I think we all need to be prepared to come to the table. Providers, consumers, there clearly is a role for the government in this. And I think a lot of the challenge is getting us out of the silos that we're in. We need to, in the insurance market, we need to break down the barriers that exist between states. Even though we have this larger debate about a private and a public plan, it would be a missed opportunity not to reform the way that we insure Americans to create greater access.
So doctor, let's go back to the concierge doctor concept and perhaps dispel some of the rumors that I mentioned at the beginning, that it's only for a wealthier class of people who can afford to go to a doctor when they want to without having insurance. It dispels some of those rumors. How does it function? How does it work? What's the affordability?
Sure, there are many different forms of concierge medicine, and there are literally hundreds of concierge doctors now offering very fine medical services for $100 to $150 a month. Now, I would argue that that's the cost of a pack of cigarettes a day or a Starbucks Frappuccino. So when you're talking about personal responsibility, I think if health is important to people, I think they should step up to the plate and pay for it. Now, I'm not here advocating concierge medicine as a single solution to the global problem of healthcare, but we need to get out of this silly idea that there is a utopian system created either by business or by the government which is going to solve all of our healthcare problems. We already know that the government has failed miserably in terms of its nationalized medical experiments, which are Medicare and Medicaid. These systems are simply going bankrupt, as is Social Security. So, if you use the analogy of having a child, if you give them a couple credit cards and they run through 2 or 3, the answer is not to trust them and give them a credit card with a higher limit. And I think that's what we're going to do if we trust these politicians to run our healthcare system. It is simply going to be a dismal disaster.
Doctor, very well said. Mr. Secretary, you have a reaction to that?
Well, I do think that there is a problem with adding a public plan onto the existing public plans we have. I think that, there have been some calls to fix Medicare first, which I think is a good idea. We already have a large governmental system that is having trouble with payments. We have already a government insurance plan, and it is, as the doctor points out, going bankrupt. So the idea that we fix the problems the government has by adding on tens of millions more people possibly to that plan seems to me sort of the height of folly. And it will increase government decision-making in healthcare decisions. There's really no way around that. The old golden rule, he who has the gold makes the rules, and that applies to government as well as anything else.
Excellent points. All right. Well, gentlemen, the conversation is clearly to be continued. Thank you to all three of you for joining us this morning.
Thank you.
Healthcare will certainly be the issue of 2009.